This is Dr. Cannell, and we're going to discuss a paper coming out in the International Journal of Cardiology in a few weeks. It's written by the doctors at Presbyterian Hospital, Columbia University Medical Center. And it's one in a series of studies about heart disease and vitamin D. This one was fairly simple. They took approximately 300 patients with diagnosed ischemic heart disease and followed them over 10 years. They knew what their vitamin D levels were, and what they found, they did what are called survival curves, and what they did is that the higher your vitamin D level, the longer you go without another event, an ischemic heart disease event. In fact, what they found is if your level was greater than 30, you had a much lower risk of an event than if your level was less than 15. To be specific, if your level was less than 15, your chance of getting an ischemic heart disease event was 2.3 times greater than if your level was greater than 30. And if you look at the curves, as I've said before, most of the benefit is going from 15 to 20 is a big benefit, but going from 20 to 30 is not as great a benefit. But it looks to me from these curves that I'd be very surprised if 40 levels of 40 and 50 didn't confer additional benefits. The authors of this paper did soft sell it, though. They said something that vitamin D may be helpful in the future, but you should remember that this proves that vitamin D deficiency is a risk factor. That's what it proves, and it's the number one killer in the United States. And this paper apparently was rushed to press. The lead author was Dr. Lauren Wasson, and I compliment her on her work.